This is Dr. Ralph Kramer's waiting room. Dr. Kramer is a pediatrician. Keep them well. Through that door is the doctor's examination room. Now,
Carl, you certainly have nice, strong lungs there. All right, now we'll have a look at your blood pressure. Well, say, that's quite a muscle you have there, Carl. Get much exercise?
Oh, sure. I'm a back on the Panthers football team. We practice every day after school.
That's so? And how about sleep? Do you find time for that, too?
Oh, I get lots of sleep.
Mm-hmm. What time do you usually go to bed, Carl?
Oh, about 8:30, 9 o'clock.
Fine. All right. Just tuck this in like that. There you are.
before he can start to take Carl's blood pressure, Dr. Kramer fits the hearing part of the stethoscope over his ears. And here is the listening part of the stethoscope. Dr. Kramer keeps it on Carl's arm.
All right. There we are. Wasn't bad, was it? Now Miss Stevens is going to take a few drops of blood from your ear. When it's been tested, she'll phone your mother and give her the report. But you know, Carl, I'll bet your blood is just as healthy as it was last year.
The nurse uses alcohol to clean off the spot where she is going to get a little drop of blood from Carl's ear. Carl thought it was going to hurt, but he hardly felt it. And now the nurse uses a thin glass tube to collect the drop of blood. She sucks at the end of the rubber tube to draw the blood up into the glass tube.
All right. Now supposing we have a look at your throat. Open wide. Just say ah. That's it. All right. Well, you seem to be in tip-top shape, Carl. I won't have to see you for another year. Put your shirt on now.
Dr. Kramer uses a wash basin with a foot faucet, so he doesn't have to touch the faucet with his hands. He always washes his hands before seeing the next patient.
Goodbye, Carl.
Bye, Doctor.
Bye, Carl.
Bye, Miss Stevens.
All right, Mrs. T. You can bring the baby into the examination room now.
The baby's first vaccination didn't take, so Dr. Kramer is going to vaccinate him again.
First, we better roll up this little sleeve. Like that. All right. We'll wipe off your arm with a little alcohol. Like that. That's it. There you are. May I have the vaccine, please? Yeah. Now, there's a little of the vaccine there. Like that. That's it. There. The needle. That's it. Now, that didn't hurt much, did it?
Dr. Kramer's office. Hello. Mrs. Porter? Yes? Oh, I'm so sorry. Is it above or below the elbow? Why, surely. Just a minute, please. For you, Dr. Kramer. It's Mrs. Porter. Betty seems to have broken her arm.
Thank you, Miss Stevens. Yes, Mrs. Porter. Yes, I know. Now, I'll tell you what to do. Cover Betty with some blankets. Yes, and try to keep her cheerful. I'll see you at the hospital very shortly. Goodbye.
And here is the hospital where they brought Betty. Dr. Kramer is hurrying to go in to see Betty in the emergency ward. Here he finds her in very good hands. Dr. Barnes of the hospital staff has already set her arm. It's in a cast, and Betty feels much better. Dr. Barnes took x-rays of Betty's broken arm before he set it and afterward. The x-rays will show Dr. Kramer exactly what kind of injury Betty had and how it has been taken care of. This x-ray picture shows just what Betty's broken arm looked like when she came to the hospital. Here is another picture of her broken arm, and here is a picture of her arm in a cast, all set to get well. Dr. Barnes has taken good care of Betty, and so Dr. Kramer is satisfied that he can leave her to go to some of his other patients in the hospital. Tommy has already been in bed a month. Though he is smiling, Tommy is worse off than Betty Porter. His broken leg is in a cast, like Betty's arm, but day and night it has to be held in the same position by traction. Tommy's going to be all right, but it'll take time. And now, Dr. Kramer is going to visit Ginny. She has had her appendix removed. She's feeling fine, but can't eat very much yet. So she is fed liquid food through this tube, which goes into a vein in her arm. Dr. Kramer checks to see that the food drips at just the right speed. The hospital is doing a good job with Ginny, and she will soon be up. The nurse tells Dr. Kramer that Mrs. Daniels is on the phone. Her daughter Joan is sick in bed with fever. And here is Joan waiting for Dr. Kramer to come.
How are you feeling, Joan?
Awful hot, Doctor.
Well, now, we'll just have to take it easy for a while, won't we?
Yes, Doctor.
All right, let's put the thermometer well under your tongue. That's it. We want to know just what your temperature is. Oh, yes, there's the rash you mentioned, Mrs. Daniels. Does it hurt, Joan, when I touch there?
Measles, Doctor?
We'll know for sure in just a moment, dear. Yes, the temperature's just about what we'd expect. Open wide. Yes, it's the measles, all right. I'm going to give Joan some medicine, Mrs. Daniels. It'll make her more comfortable. There's the prescription.
Shall I start giving her the medicine right away, Doctor?
Yes, Mrs. Daniels. You can have that filled at the drugstore. Well, Joan, I'll drop in and see you again tomorrow. So long now.
Long, Doctor.
Are you sure there's nothing to be alarmed at, Doctor?
Quite sure, Mrs. Daniels. If you keep her warm, give her light food, she'll get over it all the sooner. It's quite normal in cases like this.
Joan is going to be all right. Her mother will take good care of her. But meanwhile, Dr. Kramer doesn't have too much time. He has other calls to make. Some of them are nearby. Some are far across town, where other patients are waiting to be cared for and helped back to health.